Due to a successful operation never before performed at the Kansas State University Veterinary Health Center, one lucky dog's eyesight and quality of life has been saved. Jurinda Juno's dog Vida from Garden City, Kansas, had previously been treated for a limbal melanoma or cancerous growth on the eye. Despite this earlier surgery, Juno noticed signs of the growth's return during the summer of 2013.
I thought over the summer it looked like it had started growing again. Her eye looked like it was changing. At first I thought I was just being paranoid and imagining it, and then a friend looked at it and said, it's coming back. And I said, yeah, well, thank you for confirming that. I thought it was my paranoia.
In August, Juno met with the ophthalmology team at the Veterinary Health Center to confirm her suspicions.
We did confirm that the mass had grown in size, but we were worried that the mass would continue to grow or cause her visual problems in the future, pain, potential secondary glaucoma if it had intraocular extension.
While multiple treatments were considered, including total removal of the eye, Juno decided she wanted to try to save Vida's vision. This led to the veterinarians considering other options.
So we were looking at more novel, maybe even a little bit more aggressive means by which to try and address the recurrence of the tumor to try and be more successful long term. And that led us to investigating some alternative options. One being this procedure we did, which is called, it's a mouthful, it's called a sclerokeratectomy, in which we actually remove all of the abnormal affected tissue on the external part of the eye and use a graft from a donor eye to go ahead and replace the tissue that we've removed.
Thanks to a generous donation by another VHC client, the procedure was carried out in October 2013. Following the operation, Vida was required to spend a week in the hospital, follow a rigorous medication schedule, and wear an e-collar for almost 2 months. Vida's recovery would not have been a success if not for her owner's dedication.
I think both in her willingness to accept an alternative approach for therapy and in her complete devotion to Vida post-operatively. I just put everything in Ms. Juno's corner and give her a big pat on the back for everything that she's done in Vida's recovery.
Vida's case was not only rewarding for the patient and her owner, but for the veterinarians who oversaw her treatment.
It's really rewarding to have the case turn out so well. That's what we want for all our patients. It's always the goal. And what's interesting is veterinary medicine will throw you curveballs all the time, so you have to be prepared for them. But having an owner that will kind of be your eyes and ears whenever you can't be there really helps out in the prognosis of the case and helps you be a better doctor too. She's been a really rewarding case and one that I'll never forget.